Welcome to this very special edition of MedWeather, the #1 in medical forecasting, brought to you in association with matthewherron.wordpress.com. Today we're reporting on the situation down at the transpyloric plain, where there's an episode of acute pancreatitis about to get underway. So, as we head into the start of the week, the pancreas will be seeing an obstruction travelling in a southerly direction down the common bile duct and towards the sphincter of Oddi. And that obstruction is really going to cause some problems for us as we move into the week ahead. Clinically, we'll be seeing upper abdominal pain, often radiating towards the back, as well as vomiting, and at this time your differentials should probably include acute pancreatitis and perforated peptic ulcer. Pathologically, with an obstruction sitting in the ampulla ovata, those pancreatic juices, which you'll remember include digestive enzymes, will flow in a retrograde pattern from the head of the pancreas and back out towards the tail. And I'm told now we can go to one of our correspondents who's live at the scene. Over to you. Hi, thanks Matthew. I'm here in the abdominal cavity where, let me tell you, the temperature is really starting to rise. The pancreas is becoming acutely inflamed and hemorrhagic as fat, protein and elastic tissues are all being digested following the release of those pancreatic enzymes into the surrounding tissues just behind me. Fat necrosis is probable, and by the end of the episode we may even see a pancreatic pseudocyst developing. But now back to you in the studio. Can someone get me a towel? Yep, thanks Matthew, and we can take a look now at that CT scan, which clearly shows a pancreatic pseudocyst forming. These account for about 75% of pancreatic masses, and they can be extremely uncomfortable for the patient and may provide a focus for infection. Just to make you aware, the Department of Health has issued an advanced warning and advises practitioners to be on the alert for signs of shock, disseminated intravascular coagulation or DIC, and hemorrhage. And just a roundup of the laboratory findings for you. Serum amylase will rise quickly to extremely high levels, though of course it's worth remembering that serum amylase can be elevated in other inflammatory or obstructive abdominal conditions, and the best serological marker for acute pancreatitis is of course that all-important pancreatic lipase. And in terms of predicting outcomes for your patients, just remember the mnemonic pancreas, in which you score a point for meeting each of the following criteria. That's a partial pressure of oxygen less than 8 kilopascals, age greater than 55 years. The N up there is for neutrophilia, that's a white blood cell count of greater than 15 times 10 to the 9 litres. Calcium less than 2 millimoles a litre. The R is for renal, specifically urea, greater than 16 millimoles a litre. E is for enzymes. You want to think about lactate dehydrogenase greater than 600 units and your liver transaminases greater than 200 units. A is for albumin, less than 32 grams a litre, and finally the S down there, that stands for sugar, or glucose, greater than 10 millimoles a litre. And just remember, the higher the score, the worse your patient's prognosis. And that's your medical weather. We'll see you next time.